So good afternoon. This is Keisha. Thank you so much for making time to be on today's call. We're really excited for our speaker, excited to connect with everybody. I don't know if any of y'all are at home today on a snow day. I had a snow day yesterday, but if you are, thanks for making time to be on the phone. So I just thought we would begin with our PAPRN Plus updates. And the first thing I want to say is thank you to everybody who made time to come to our social at Active Living Research. We had a great time in Banff, and it was just really wonderful to connect with all of you. It's nice to get some time to see each other in person every now and then. So again, thank you very much. And I want to remind you that, we have this forum, and if you're interested in presenting your work, whether you're a researcher or a practitioner, there's always an opportunity to present on this call, and I encourage you to reach out to me if you'd like to do that. The other update that I'd like to make, and again, I'll remind folks at the end of our call about this, is that we have been asked to spread the word to all of you to provide feedback on the physical activity guidelines. The Advisory Committee Scientific Report released their document, and the comment period closes at midnight on April 2nd. So just wanted to remind everybody, if you haven't had a chance to take a look at that yet, please do, and provide your feedback. It would be great to have lots of thoughts on that document. So let me turn it over to Tom to do some CDC updates, and then we'll come back and finish with some other coordinating center updates before our presenter goes.
Okay, thanks, Keisha. I'll just follow on the PA guidelines feedback, just for people to know. All the comments are reviewed, so they don't go just in a black hole and just languish there. Each one of them is looked at and in some way thought about and responded to. The other is, you probably are all aware that it looks like we're almost there to a budget, which is good news. At least the way it's formed now, we're better off than the original plan. So we've got our fingers crossed on that. Related to that is we'll be having a meeting with the OD management about plans for the next PAPRN, whether there would be one and what would be the best model for one. Both NOPRN and PAPRN will be at that meeting. And so people that have comments or suggestions about how best to move policy research forward through a network or through a centralized project, through a common project, or maybe rethinking the whole enterprise to more of a translation and dissemination model. The OD people here are especially interested in things that happen directly with the community. So I'm going to share a sort of summary of what Arizona is doing, which has both the academic papers, but also a lot of community intervention or community actions that they've been associated with. So I'll share that, and if people can use that as a model to think about how they can summarize their work, that would be really great. Thanks.
Great, thanks, Tom. And Tom, I might have missed it. This is Keisha. When is that meeting happening, or when should we provide input to you on this?
I just got an email. They're trying to organize. It'll happen pretty soon. So okay, in the next couple of days. And we've talked about this, but if you have new ideas or just a burning idea you want to promote, make sure you get it to me.
Okay, great. Thank you. Okay, great. Well, thank you, Tom. Does anybody have any questions for Tom about anything from the CDC? Okay. All right, so we'll move on and just continue with our coordinating center updates. Amanda, I think you were going to provide some work group updates.
Sure, I'll just keep it brief for the coordinating center updates, and then maybe when we get to open mic, if there's some additional time. I know there's probably someone from each working group on the call, so if we have time during open mic, it'd be an opportunity for those folks to talk about some of the subgroup projects they're doing. But for now, I just wanted to highlight the working groups that we have going. So for those of you who are not already in a working group, we have several groups going. So we have Complete Streets, Older Adults, Parks and Recreation, Rural Physical Activity, School Wellness, which is coordinated by PAPRN, and the Workplace Health Promotion Group. And all of those groups are working on some kind of subgroup project. And so just a reminder, if people can mute their phone if they're not talking. We've just got a little bit of background noise. Thanks. And so if you are interested in getting involved in a project, those groups are always thinking about new ideas. So even if you think that it's too late to join, we welcome you to jump on those calls. And if you're interested in a specific topic, I'm happy to add you to the listserv. Sorry, just a reminder to mute your phone. I think there's maybe a few people that have their lines open that's causing a little bit of background noise. So yeah, that's maybe all I'll go over for now. And then again, if we have time during open mic after our presentation, we can get into a bit more detail about some of the projects that are happening. And one other reminder, somewhat related, that I wanted to send out on the phone. And Tom, this made me think about if you have a meeting coming up. We do have a tracking sheet of PAPRN products and projects that are going on. And so if you have presented or have any PAPRN related items that you need to add to that, we'll include the Google Doc link for that so that you can update that and make sure we always have the most up-to-date list for Tom to refer to when he's going into meetings to talk about PAPRN.
You're going to send that with the minutes?
Yes, exactly. Yep. And I know some people presented at ALR. I haven't had a chance to look and see if those were added, but I know there were some presentations at ALR specifically related to PAPRN work. So make sure we want to get those added.
Yeah. Great, Amanda. Thanks for that reminder. Yeah, we definitely want to make sure that that link stays up to date for Tom to just go to and is able to report back to the CDC what's going on. And thanks for that update. And we certainly, if there's time at the end, can continue to talk about the work group. All right. Great. So let's go ahead and jump into our presentation. And let me just remind folks to please mute your phone so we can reduce the background noise while our presenter is speaking. And I am thrilled to welcome Belle Gerard to our call today. And Belle is the Policy and Opinion Research Manager with the National Office of the American Heart Association on the Voices for Healthy Kids initiative. Voices for Healthy Kids is a collaboration with the Robert Wood Johnson Foundation focused on passing public policies related to healthy eating and physical activity at the state and local levels. Belle is based in DC and began her career in politics and campaigns. She's worked on Capitol Hill. She's worked at a public opinion research firm and at a progressive think tank. In her role at Voices, she leads their policy and messaging research and is here to present some of that research today. And her talk is entitled Messaging for Active Living. And again, I want to remind you to please mute your phone if you're not speaking. That way we can hear Belle. So Belle, we'll turn it over to you. Thank you so much for being here today.
Yes, and thank you, Keisha and Amanda, for inviting me and for everyone for joining today. So in pulling together this presentation, I was mindful of the fact that some of you have heard us do many presentations over the last 5 years on Voices for Healthy Kids and larger research that the Heart Association has done, and others may be entering into this conversation not having had us present before. So I'm kind of trying to balance both of those and sharing a little bit of research we've done prior and then focusing on some new research that we've just released in the last few months. So as an overview, I'm going to share some of the background research that Voices for Healthy Kids has done, some of our messaging one-pagers as a tangible resource for use. And then what perhaps some of the newer research for us, for you all, is the health equity messages we've developed for using with policymakers. And then throughout this presentation, I'd love it if you can keep in the back of your mind, any messaging needs that pop up or questions you have. I'd really love to have a discussion at the end of this rather than just sort of silence. So any things that pop into your mind as we go through this, I would love to hear them. So First and foremost, Voices for Healthy Kids has done a lot of research over the last 5 years. We've done 18 national message research projects where we have done a series of in-depth interviews with key stakeholders. They can usually consist of focus groups, a national poll, some other methodologies. And in addition to those national projects, we've also done, we just launched our 275th state and local poll. This one was related to sugary drink taxes, but we've done lots of research across a variety of areas, including policies that fall under the active living space.
And competing webinars.
And I'm not sure if that was a comment for me. Okay. So moving forward. And a lot of the findings from this research can be boiled down and captured on our messaging research website, which is included here. You'll see voicesforhealthykids.org/messaging. So one of the things we hear first and foremost from our advocates in the field is, this is great research, super interesting. Boil it down for us. Give us what to say, what not to say. What are our top tips for messages as we're engaging with policymakers, voters, other advocates out in the field. And so this website is meant to have, captured all of those sort of top tips that come to mind. Some other overarching messaging tips that we have found just to kind of enter into this discussion today can be found in more detail in a health equity guide, which I'll be sharing in a minute. But just to kind of frame where we're coming from in this, what have we learned big picture wise that impacts across all of the issues in which we research and message within in the policy spaces in which we work. So the first is to identify issues and solutions together as a community, then customize messages. So one of the most important things that we've learned, which won't, I imagine will not be a surprise to those of you who have been working in the field for quite some time, is that community members most affected by an issue are the best people to help you understand the issue and identify solutions, but also to customize the messages. So one of the oversights that we often have is we kind of looking at the national scope or, slightly removed in our public health spaces, we do all this testing, we create these messages, but we do it without involving the community in that process. And so one of the top lessons we've learned, especially as we take sort of these overarching messages that we found do well, is to actually play them out with community members and see how they react to them and if they would have any recommendations on how to tweak them or fill in specific pieces of information that may be helpful. The next tip is to be strategic about who tells the story. So, the storyteller is everything. One of the things that we do in all of our research is we make sure to test who the most effective messengers are with voters. So we'll ask voters in our polling, for example, do you trust hearing messages from the Centers for Disease Control, or do you trust hearing messages from the Heart Association or a pediatrician, a local policymaker, et cetera? And we see sort of depending on the issue, what rises to the top. So on some issues, they're more likely to trust national organizations, whereas other issues are more likely to trust local stakeholders. So that's something that we're always being mindful of as well. The other thing is to use we language. So this is something that, I think a challenging shift for a lot of us to do, to move away from I as both the individual and I as a single organization to we as a larger collective group of advocates trying to make policy change, to be mindful of that. And an example would just be using language such as we're all in this together, versus setting up a message where it's sort of us versus them, which we found, does not help pass policy or move us forward. The fourth tip is to demonstrate greatest need. So one of the challenges that we hear over and over again from our advocates out in the field, especially our government relations directors as they're advocating for policies, is that they don't have data specific to their small community in Oklahoma, but there may be another community in Oklahoma or nearby that has the data to show that, for example, a complete streets policy is effective. So while it may not be, exactly at home, it's similar enough to show that, hey, there's some, this has worked well over here, it could work well for us. So, if possible, show how two different communities are similar in a disadvantage and how the policy would help them both. Another way to do this, or another way to think about this, is to show a policymaker who may be more interested in passing rural policy, maybe that's the population they represent, versus urban, or vice versa, how this particular policy can help both entities. So it may help us here in a more rural capacity, but it's also going to help a more suburban or urban neighborhood, to show sort of alignment across districts and across policies. They also, so tip number 5 here, then show how everyone benefits. So it's important to be ready to show how improvements in one area can benefit the broader population. Also be ready to state how the policy can eventually be expanded. So including parameters that specify how progress in the initial area will be tracked and evaluated, or when expansion will happen. So kind of having that forward vision is particularly helpful with decision makers. So, just to quote one decision maker that we spoke with, and again, I'll share a little bit more about this in our health equity project overview, is that you need to emphasize that if the project benefits the most needy, it benefits everybody else as well, in order to convince them to support a policy we're working on. 6 is to use stories to show what gaps in the community look like. So, one of the, we say this is like a huge asterisk next to it, because we don't want to overwhelm them with data. That's sort of the next talking point. But we do want to be able to show them through different ways, how that would look. And one such way would be, just telling a really good story, showing success. And then the bit about the 7th tip here with data, we tend to go still, even though I think this is starting to shift, we still tend to go to decision makers with, lots of facts about lots of things, and think, just like, look at all these facts on this piece of paper, look at this study that was done. Doesn't this just say it all? And that isn't effective. What is effective, or what we have found to be effective, are maps, so those visualizations, as well as social math. And we at Voices for Healthy Kids, we do an entire separate training around how to use social math effectively. And there's certainly lots of other tips and tools out there for that piece, but that we found to be particularly effective. And the last tip here is to anticipate, but not lead with details about economic costs. So right now, I think more than ever, the number one question that we get when we're advocating on policies is, show me the economic data. Show me how this, putting this grocery store or this biking path, how that will equal, a reduction in medical costs, an improvement in health, all of those pieces. That is the hardest. It's frustrating because it's the hardest thing to show with a lot of the policies in which we work. So being prepared to answer that question is important, but it's also important not to lead yourself down that avenue, or to, offer that up right off the bat, especially if you don't have strong data to back it up. So within our messaging one-pagers, we have 3 that apply to the active living space. This is likely research that you have already heard us speak, as several of them, we've been working on for the last few years. One is around safe routes to school messaging. And so if you visit our website, again, voicesforhealthykid.org/messaging, you'll find these one-pagers there that have, walk through a lot more tips around effective messaging around this space, as well as the space of complete streets messaging and physical education. While I could walk through in much more detail these 3 areas, I think that the messaging one-pagers summarize it pretty well. It's a lot of content, and I wanted to make sure that we'd have time to get to some of the newer research we've done around health equity, as well as save some time for discussion. So I'm going to skip over those for right now, but I'm happy to answer questions about them later if you have them. So jumping over to our health equity research. So one of the top things that challenges that we have faced in the history of Voices for Healthy Kids over the last 5 years is that health equity is the center to all of the work that we do, including the public policies that we're advocating for. but that our advocates felt like they weren't properly trained or prepped in order to have these discussions. So even our, government relations staff or our advocates that have been working within the field of public health and policy for years, advocating for lots of different policies, this was still a new space for them. So while they may be comfortable engaging in those conversations more largely, when it came to specific conversations around health equity and those components of policies, they were really struggling to have those conversations. And quite frankly, we're getting lots of doors slammed in their face as they tried to kind of stumble their way through. So we recognized this and decided to invest in creating a messaging guide that would specifically address this challenge. So the goal of this project was to motivate decision makers to include health equity language in the public policy itself. And we know it's tempting to pass a policy and then go back in the rulemaking or other phases of the process and add specific language in. So this sort of sense of like, well, this is going to be a tough conversation, so let's just get what we can now and then we'll go back. But we've seen that decision makers, they balk at that, saying like, these provisions should have been included from the start. It's too late now. So we're trying to get into the process before that happens. And we also know that details added later are easier to change and can be forgotten. So we want to make sure this language is baked in from the very front in order to be resilient to change. So I'm sure this is an image that many, if not all of you, are familiar with. The new sort of diagram that that the Robert Wood Johnson Foundation has created to describe sort of health equity and what it means. It's great to see it that it's in a more active living space compared to previous versions. And throughout this project, we've learned that from built on our health equity message work of our funder and partner, the Robert Wood Johnson Foundation, that this definition and illustration are from the foundation. So that it's from the foundation, but put simply, health equity means that all of the basics to be healthy as possible. And so that's what we're ultimately striving for in this space. And it's what is the cornerstone of all of the policies in which Voices for Healthy Kids works on. I'm going to kind of skim over the next few bits just to kind of give you ground level. I know that this diagram alone and this issue could be many more conversations, but just trying to give an overview. So within the world of Voices for Healthy Kids, our health equity policy criteria is focused on whether a policy explicitly benefits racial or ethnic populations or low-income communities, whether it explicitly addresses determinants of inequity, includes provisions for measuring inequity and monitoring and accountability, or whether it involves disadvantaged populations in monitoring policy implementation. So these are the things that we consider as we're developing our policies around issues like complete streets, biking, appropriations for biking and walking, safe routes to school, shared use policies, et cetera. This is what goes into our policy creation. And ultimately, these are the types of things that we are fighting for in the policies that we're trying to pass at the state and local level. So here's just a cover of the guide to see. It's available for downloading on our website, voicesforhealthykids.org/health equity. I strongly recommend you do so, as there's a lot of good information in here, and I'll just be highlighting some of it for today. But before we dive in, I want to share a few context points about this messaging guide. So it's specifically intended for policy advocates talking with decision makers about public policy. And the messages are designed to be open and sustain the conversation and secure policy language. Over time, we believe that it will also build capacity and that for both advocates and decision makers to talk more openly about health equity. We just don't feel that we're quite there yet based on the research that we have done and what we've heard firsthand from advocates out in the field. So the guide's going to provide some insights for community advocates and organizers, but it's not meant to be the right language for them to use. So for those that are directly engaging around equity, this may not be, this isn't meant to be the guide that you turn to. This is meant to be more for those that are sort of more on the outskirts that are trying to pass policies that include health equity. Here is some language in order to do that from where we are right now in the political landscape in which we're operating. So for organizing work or community advocates that can be more direct about health equity, racial discrimination, and historical injustice. This is not the guide for that, but rather it's more specific for policy advocates working with decision makers as we are right now. So sharing a little bit from the guide about where it operates under. So again, the specific point in the process is focused on when decision makers are open for the need for language. So you've already established that, yes, this is a policy they're interested in exploring. Yes, they want to explore it with you. And now it comes down to what will the bill language look like? What will the policy language look like? And so they're open to your recommendations for language. That's, no small feat. We recognize that. That's a lot of steps. But you're at this point where you're trying to determine the language, and you're trying to get the decision maker to commit to the language. So they already support the policy concept. Now you're just trying to get it over the finish line in terms of what language it includes. So again, advocates have already built up a diverse coalition. They've already, had those initial conversations with the decision makers. And what will come after this is decision makers actually enacting and enforcing the language. So this is those middle arrows right there. So one of the things that we knew right from the beginning in this work is that values were going to override facts, and that this needed to be a values-based research project. To do this research, we used Metropolitan Group, which is a firm out of Portland, Oregon, and has offices in DC and Chicago and Mexico City. And they're really fantastic, great. They've done a lot of great work for the Robert Wood Johnson Foundation in the health equity space, including research around healthy weight that I highly recommend you check out if you haven't already. And we also used two different pollsters across the aisle. One, Celinda Lake, who works more around progressive polling work, and then Kristen Anderson, who works more on the conservative side, in order to complete this research. It included lots of other pieces as well, which for those of you who are interested in the methodology specifics, happy to answer those questions or talk offline. But what we know is that people make decisions first by applying their closely held values, and then by filtering facts and new information through those values. So, values are the glasses, as these cute girls are showing us, through which people see and interpret their world. And a persuasive argument has to be grounded in the closely held values of our audiences. So often messages are based on a single value, and that works in many cases. Here, though, we are introducing is a narrative based on a combination of two values plus a specific policy outcome and approach. So we started with the research to identify values that have been shown to be dominant, enduring American values, cultural values, and to help people think at a systems level. We're also trying to resonate with people across the political spectrum, across the span of political ideologies and parties. That in particular was really important for us. We didn't want to just be catering to one political party. We wanted to find messages that spoke to everyone, because you never know who's going to be in the room or who you're going to be engaging with on one of these policies. It's going to have to be across the aisle. So from the values that emerged, we created messages and started testing, and we'll walk through those today. And they were tested with, and this is a little glimpse into the methodology, with decision makers. So we spoke with over 50 policymakers at the state and local level across the country, across the political spectrum. We revised the messages. We did some field testing of them through our government relations staff. We did a national poll. We had roundtable discussions, lots of other pieces with them, and then went back and did some final retesting with our decision makers to ensure that these were strong values. So going into this research, we also had some assumptions based on lots of prior research that has been done. And if you're interested in this, there's no short of a dozen TED Talks that talk about other values-based research. And that research has found that, generally speaking, liberals tend to value equality and fairness, care and protection, and conservatives tend to value loyalty and patriotism, respect for authority, and purity and sanctity. So these were just some grounding values that we knew going in, and that were, pretty separatist in the environments that they created. And, looking beyond just treating everyone with empathy and respect, which of course we all should do, we wanted to find what are those values that transcend across the political spectrum. And what we found were that the two values that we explored, over a dozen values, and the two that landed to truly show across the aisle were values that speak to both human potential and community. So those two core values, human potential meaning the value for human growth and success, of hope and what is possible for our country, and the belief that everyone is able to achieve their full potential. And then community, so connections, interdependence of our society, loyalty to the group or community. These two, no matter whether we were talking to an ultra-conservative white male legislator in the South or a super liberal female legislator in the Pacific Northwest, we found these two to be the shared values that they both held. And ultimately, we also found that another effective tool woven into these two values and messages that have these values at their core was a focus on the outcome of effectiveness, like how effective will this policy be? And certainly with all the researchers on the line now, that's why your data is so incredibly important to us and so helpful as we are going out and advocating for these policies. And then also an approach of targeted universalism. So this sense of, if we target a policy, if we start here, it'll help benefit everyone else. So, one of the challenges we had is we use targeted universalism a lot within the scope of public health, but of course, it doesn't mean much to those outside of our little world. It's a concept that's aiming to help everyone, starting where the need is greatest and then expanding to help everyone else. And it's this combination, help all, start where the need is greatest and then expand, that defines targeted universalism. And voters and decision makers agree that this makes sense and agrees to effective policy, which is the good news. They believe in the concept of targeted universalism, as long as you don't describe it as targeted universalism and instead talk about what it looks like. So, just to reiterate, don't use that actual term, but rather what it represents. And these things together, human potential, community, outcome and effectiveness, and approach through targeted universalism, we found to produce a productive conversation as we engaged with policymakers around the idea of specific policies. So we used examples of policies to have these conversations, and would you support entering in from these frameworks? And we found that indeed they would. So in the Health Equity Messaging Guide, we have this sort of worksheet that walks through how to build a strong message. Obviously, there's a lot of information on here, so it's really just meant to show you that this exists, and it kind of walks you through each piece of this, of how to do it. And we also drew an example from the Complete Street Space, thanks to Jamie Chickry and some of the research she has done in this area, as well as other advocates who have been working on these policies for us. But some top takeaways from the messages is that we want policies to be effective. We want everyone to benefit, starting with the communities that have the greatest health and/or economic need, and then expand. That means looking at places where there's the greatest gap, focusing changes there first, so that people are able to reach their full potential and that any community could be eligible. So we can help communities work together and be stronger. Choices that they make depend on the options they have available. And then, for example, one of the messages that we have tested, is that here's the essential, it's essential to share a locally relevant example for the policy and geographic areas that describe the challenges. So again, going back to some of those initial tips about where, and that the connection between the community conditions and health isn't so obvious to decision makers. So that makes it extra important. So the example we tested was that, which was well received, was from Ohio. And we said, in many areas, the only places to buy food are convenience stores and gas stations. One rural county had a large aging population that had to travel 30 miles to reach a store selling healthy food. To address this, the state passed a healthy food financing policy that brings grocery stores into those areas or helps existing corner stores get up to sell fruits, vegetables, and other healthy foods. As a result, after more than 4 years without a place to buy any healthy food, a grocery store will be opening. Residents are excited about what the store will bring in terms of healthy food and jobs to their area. So, while this wasn't obviously in the active spaces policy area, this is just one example of how we, tried to use this messaging guide and then tested it out to see how effective it would be. And so then, of course, the ask becomes, we're asking you to include this specific language, and then you'd go into the greater details. So all of this is laid out much more, in much more detail in the guide, but I just kind of wanted to give you an overview of what that looks like. So just a few quick takeaways. I'm going to go through these really fast because I know we're already only have about 20 minutes left. So as part of the project, we did a national poll. I mentioned that we used Linda Lake and Kristen Anderson to do this research. And just to share some key takeaways around that. So one of the things that we explored in the poll was the role of government. So what's more important in our society, that everyone be free to pursue their life goals without interference from the government, or that the government play an active role in society as to guarantee that nobody is in need. So you'll see here that 52% think government should stay out, 41% think that they should be in, and 7% are not really sure, which we found this to be true across a variety of different polling that we've done around the role of government, around the space of preemption and other things. So this is sort of what we're dealing with in this political landscape. And this was done early last fall, just to give you a timestamp on it. We also explored the role of parental responsibility. So selecting, again, which statements are parents responsible for making do with whatever resources they have in order to raise healthy children, or communities responsible for making sure parents have what they need to raise healthy children. And as you'll see, there's much more emphasis put on its parents' responsibility versus a community. So again, not the most upbeat finding, but I think important just as we go into this work, what is resonating with voters. And then agreement on equity value statements. So we tested some different value statements in this poll with voters. And I should say that we, while this is only a small portion of the overall population size in which we tested, we did do an oversample of what we call Obama-Trump counties. So they're counties that went from Obama to Trump, and voters, who were strong Obama holds in 2008 and 2012 that then voted for Trump, and why. And so that was, we were particularly interested in those because that has been some of our most challenging counties and parts of the country in which we're trying to work. So just to give you that lens as we talk about these. So again, just looking here that, no one's health should be compromised because of who they are and where they live or how much their parents earn. So about 55% strongly agree. The rest sort of agree. Everyone should have the opportunity to be healthy, live up to his or her potential, and participate fully in society. Again, we're in the 50s, strongly agree. Everyone should have full access to the opportunities they need to be healthy as possible, no matter their income or race. And everyone should have full access to the opportunities they need to be healthy as possible. So ultimately, what does this say? It says we're split on a lot of these values. And so again, it just helps us kind of paint the picture of what we're up against as we're trying to do some of this policy change work. And I'm actually just going to skip over this one for time. So, lastly, one of the more encouraging things was that we found that people do care about policies, supports policies that aim to give people the opportunity to enjoy benefits of good health, no matter their income, race, or where they live. It does play a role as they're thinking about whether they're more likely or less likely to support a candidate, which is positive in that means that there is hope and there's room for change in some of those spaces in which we're working. So just trying to end on a more positive note. And with that, I will just open it up to questions and discussions. I know this is a lot of information, and I know I kind of ran through it quickly. Again, much more can be found in the messaging one-pagers and in the guide. But what came to mind for folks are, you know, and or were there any other messaging needs that are top of mind for you all that I could be adding into our sort of exploratory list as we have other opportunities to do research?
Great. Belle, this is Keisha. Thank you so much for a great presentation. And so we'll certainly open it up for questions and comments. I know I have a couple, but let me see if other people want to start and with some questions for Belle, or even a direct response to your question you just asked about other research needs around messaging. If you're on mute, I mean, I encourage you to unmute your line to ask your question. Maybe, Belle, this is Keisha. Maybe I'll just start with my two questions, clarifying questions on your slides while people are sort of thinking of other things to ask. The first point I wanted to, or the first question I had for you was, can you say a little bit more about the, about not leading with the cost, right? Because I can understand if you don't have cost data or strong data, but if you do, and you're going in to interact with a policymaker who you know that's going to be the first thing they ask you, I mean, do you feel like there are certain times where that is the right strategy? I sort of think about the work that I've done with certain policymakers who I know care first and foremost about the cost. And is that caution really about when you don't have strong data, or?
Yeah, that's a great clarifying question. Yeah, thank you. So what we found was that that decision makers were sort of, so some decision makers were wary of economic data because they felt like the cost-based arguments can be overused, and that some of the claims, like such as, you know, spend $1 now, get 33 in return, feel unrealistic or feel too far down the line. So you have to you have to remember that these are individuals who are, you know, often up for election every two years, or, you know, depending on the state and the position in which they're in. So they're always thinking about the next election, right? And so for them, economic data that shows like 10 years from now, 20 years from now, they're like, that's not going to help me get reelected. Right. So why should I care about that? So I think that was some of the wariness we found. And so kind of keeping that back in the back of your mind. But we did find that prevention data that focused on either preventing disease now costs less than treating it when it becomes far worse, which is, you know, down the line, but that for some folks that was more effective, in particular amongst more progressive leaders, that healthy people are able to be at work every day, which is a good for employers. So anytime you can show like work employee data was helpful, and that healthy working people earn and spend money, which builds a tax base. So those last two were more effective with conservatives. So it's more about the kind of economic data you're using than, and just being mindful of like when you're projecting and how realistic that projection seems. So it's just, you got to use caution, right? You need to be pretty savvy going into that is all. Right.
Right. Yeah, very helpful. And I think I've certainly found that question about the tax base and support for employees works a lot, has worked a lot in messaging. So thank you for clarifying that. We have a question on the chat box. It says, how would you suggest, or what is being done to get this type of messaging information into college curricula?
Oh, that's a great question. If I can just quit my job for a year and just go speaking to every school of public health and public policy out there, I certainly would. I think that, you know, it's an interesting question, and I know that we have had some uptake amongst some schools of public health and public policy, like George Washington University, for example. A few professors caught one of our presentations and asked if, you know, we could supply them with some guides and if they could use it as part of their curriculum. But to be honest, we haven't, you know, we don't have an organized space for that. Like, we haven't figured out a strategy, but we're certainly open to it, and, you know, are happy to share this research in any way. And I think I love the idea that it's something that should be part of the curriculum and thought about before or before our new advocates go out and join the workforce or re-enter the workforce, certainly. Any other questions?
Yeah, I have more, but I'm gonna maybe pause and see if other people want to chime in. Wait a few seconds. I'll just follow up then again, Belle. Your last slide that you presented on the decision maker support, I thought was fascinating. Did you guys look at that by the by political affiliation, like the counties you mentioned that were for president, like this slide, the one that you, yep. Did you look at? Okay. Yep, this one, yeah. Did you look at that one too in the counties? Did you stratify in those counties that were Obama that then went for President Trump? Or just wondering if you guys were able to dig down a little bit more into this. I'm curious if there were some political affiliation differences.
Yes, and it's probably not all that shocking. I think there are, unfortunately, I think this is a situation where, the generalities or assumptions turned out to be true, that in overall more progressive counties or counties that went either, entirely for Hillary or were more, were lighter supporters of Trump amongst those who had supported Obama previously, were more likely to take this into consideration or feel that it plays a role in the candidate they vote for than those who were stronger Trump supporters. So it is, there is definitely a political divide with progressive folks being more mindful of how this plays into, equality plays into the candidates in which they vote for. So, not as shocking, and certainly the crosstabs go into much more detail about, like, if you're a single female voter who voted for Obama and then voted for Trump in such and such district, you went this way. But off the top of my head, that's just sort of the summary.
Mm-hmm. Great, thank you. Yeah, I expected that, but it's nice that you guys have the empirical data to sort of show those points.
Yeah, absolutely.
Hey, this is Stephanie. I asked one of the previous questions to the chat box, but I'm also wondering how can we use this information to encourage other people to run for political office? This is something I'm really interested in. We need more well-informed individuals to run for political office at all levels, from city level, state, national. So do you have any thoughts on how we can use some of the information you're finding to get new types of people to run for office?
Yes, I mean, that's a great question, and I think a little bit outside of my area of expertise, but I think, so this does not answer that question directly, although, and I welcome others' ideas and your ideas. Please, if you have them, please share. One thing that's sort of been interesting is that I did share this guide with some folks who are currently working as legislative directors or chiefs of staff on Capitol Hill across the political spectrum, folks that I used to work with or that have, that I've just known over the years. And it's been interesting. They've been using this guide as a tool to advocate for policies with their own representatives. So the policymaker, their boss, the policymaker that they work for, using this as sort of a strategy when they really want to be working on a policy and maybe the person they're working for does not, sort of how they angle the conversation just internally, which, is a small win, I think, and that it's changing minds from those that they trust most. So I guess that's one small internal avenue, but not quite what you were raising.
Yeah, thank you. That's a huge question, but I work at NDSU in Fargo, North Dakota, and we have a master public health program here. And we're finding in our state of Dakota that a lot of our graduates are getting very politically involved, and we have a very red state, always very red state, which is fine. But it's interesting to just see anecdotally from our graduates and how we maybe address some of our curriculum aspects, that maybe some of our faculty are a little more politically driven to show how policy can influence health outcomes. It seems like that's kind of where some of our graduates are going, and I think your information is very, very helpful, but I'm not sure what to do next with it, in a more organized fashion. So yeah, thank you for answering. It's a big question.
And Belle, this is Keisha. I have one other question. As I was hearing you go through this great data, I was wondering about your thoughts on how sort of generalizable these findings are to a number of topics we care about, right? So when I have colleagues who are maybe even working outside the activity space and are looking at other public health issues, do you feel like the kinds of strategies you guys did around message testing needs to be replicated, or are, you know, those key tips you mentioned, are those pretty generalizable to any issue? Or just wondering if you can talk a little bit about that part of this.
Yeah, absolutely. So I shared one example that we used, which was around healthy food financing, but we actually tested a lot of different policy areas. The one exception was healthcare, just because at the time when we were doing some of the in-depth interviews, we were right up against ACA and things that were happening. And, you know, that is in and of itself such a, even beyond some other issues in which we work, politically charged space. And so we didn't want this to be all about healthcare and Medicare and Medicaid. So we focused more on the policies that were anything but. So we did use examples and have conversations around tobacco, around our health, active living and healthy eating spaces. And then we did explore a little bit outside of our zone. So we talked a little bit more about sort of wellness from a more comprehensive space. So looking at policies that include, you know, focus on inclusion or children with disabilities, or, you know, some of the areas in which we may touch on in some of our policies but aren't so focused. And we found that these messages worked well across those topics. But again, that's all under the umbrella of health, right? They all touch on health in some way. Mm-hmm. We did not test policies that, you know, we did not test messaging or policies that are completely removed, like national security or something else. Although I would be thrilled to hear if people, you know, did try them out in some of those other spaces and what they found.
Great, thank you. Very helpful. Before we sort of wrap up this portion of the call, let me see if there are any other questions, and I'll see if you have any closing comments for us, Belle. But any other questions for Belle?
This is Amanda. I may have one quick question. I think one of the things that sometimes we struggle with is trying to find those storytellers, so someone to bring the data to life. So I didn't know if you had any tips on, you know, how to kind of tie your data into a story that you obviously can't make up. And maybe that's through, you know, that happens maybe more at the advocacy level. But I think researchers sometimes struggle to find those stories.
Yeah, and I don't know if I'm the best person to answer that, Amanda. I think there's folks on our team that are more focused on finding those stories and may have better tips. But I think in the context of this research that we have done, one of the things that we heard from policymakers is that it's so incredibly frustrating to them when an advocate, you know, like let's say a government relations director from the American Heart Association is coming in and sharing a story that is not their own, you know, the story of somebody else, and somebody else who is supposedly their constituent but is not there, or they haven't had contact with. They would much rather hear it from the constituents themselves. And so I think it's using, you know, but that doesn't help solve, like, how do you find that constituent, right? Like, how do you find that community member? I think that's where it's become so important to be more in touch with the actual community and people working in this space. But that was one thing that we heard, you know, from them as sort of a tip of, like, it's really frustrating when you hear somebody just representing someone else versus the actual person that we are charged with representing. So, you know, not exactly an answer, but just something to think about. And then I think just in general, as a public health movement, we need to try to do a better job of creating a central database of storytelling that we can pull from. I know it's something that we've talked a lot about on Voices, is that when you find a good story, like making it available to more people for use and creating that sort of, you know, contact information, et cetera, versus it sort of being this, you find it and then use it and then it doesn't get, you know, used or repeated again. So.
Mm-hmm.
Great. Yeah, thanks. It's helpful.
Great. Belle, thanks so much for a terrific presentation today. This was incredibly useful, and thanks again for making time to present to us. And thanks to everybody for being on the line and for the questions over the chat box. So thank you. Before we wrap up, just wanted to give folks any time now at the end of our call to for open mic to share announcements or let us know things that you'd like for people to be aware of. And so we'll take some time for that, and then we'll wrap up today's call.
Hi, Keisha, it's Jamie. I have an open mic item. First, Belle, if you're still on, great presentation as always. Thank you. We've been funded by the Physical Activity Research Center to support a rapid response project for Voices, actually, that we're also co-funding with some of our collaborating funds under our PAPRN Plus project to study the engagement of public health officials and advocates in complete streets policymaking, implementation, and/or evaluation efforts. Many of you may have seen my tweets, Amanda, ALR, and Park's tweets, Christian's tweets. Thank you, everybody, for helping me spread the word. But shockingly, our nomination rate is really, really low. So nominations are open till next Friday, the 30th. We're looking for, originally we were just looking for municipalities, but Christian emailed us a great example of a state. So we're going to open up the nominations at least more broadly to include possibly municipalities, states, regional MPOs, so we can see sort of the spectrum of what we might be able to focus on. But it's going to be a large-scale qualitative study follow-on to the equity one that we did for Voices and Park and PAPRN before. And this is really going to highlight examples of best practices of how public health practitioners can get engaged and support complete streets initiatives in their communities. So if you know of any great examples, please nominate. You can look at the ALR Twitter feed or the Park Twitter feed, my Twitter feed, but they have a lot more followers than I do. So thank you.
Yeah, Jamie, thanks. And I had sent it out through PAPRN Plus, and I'll do that again when we send out the minutes from this call.
I would really appreciate it. Thanks, Keisha.
Jamie,
Welcome.
How long does the nomination form take? I think it's relatively
2 minutes.
Yeah. So I think
2 minutes. It's a really simple nomination. It's like, and I even changed all the nomination fields to provide me basically whatever information you have. The main thing I just need to know is the community, and just a brief explanation as to why you're nominating them. But if you don't have a URL for them, if you don't have any documentation, that's all fine. The longest time is just to tell me who you are and to tell me the community you're nominating. So Christian, you're on. How long did it take you? 2 minutes?
Maybe 83 seconds.
83 seconds. All right. Well, thanks, Jamie. We'll remind people of that when we send out the announcement. So seeing that we're at time, let me go ahead and just thank everybody for being on the call today. Again, if you're interested in presenting on the next call, which is in May, please reach out to me or Amanda, and we will certainly add you to the agenda. So thank you again, everyone, for your time, and hope you have a great rest of the week. Take care. Bye-bye.
Thanks, everyone.
Bye, everybody.